Disease overview. Introduction. Signs and symptoms. Individuals with abetalipoproteinemia may experience a wide variety of symptoms affecting various parts of the body, including the gastrointestinal tract, neurological system, eyes and blood. Affected infants often present with symptoms relating to gastrointestinal disease, which occur secondary to poor fat absorption. Further, patients do not have any ApoB-containing lipoproteins in their plasma, and consequently they have very low levels of triglycerides, cholesterol, phospholipids and ceramides. Between the ages of 2 and 20 years, a variety of neurological complications occur that resemble spinocerebellar degeneration, a general term for a group of disorders characterized by progressive impairment of the ability to coordinate voluntary movements due to degeneration of certain structures in the brain. Cerebellar ataxia. Additional neurological symptoms include loss of deep tendon reflexes such as at the kneecap, difficulty speaking, dysarthria, tremors, motor tics and muscle weakness. Causes. Abetalipoproteinemia is caused by changes, mutations or variants in the NTTP gene and is inherited as an autosomal recessive genetic condition. Genetic diseases are determined by 2 alleles, one received from the father and one from the mother. Affected populations. The exact prevalence and incidence of abetalipoproteinemia is unknown, but it is estimated to affect less than 1 in 1 million people in the general population. Abetalipoproteinemia affects both males and females. Disorders with similar symptoms. Familial hyperbeta-lipoproteinemia due to secretion defect 2. FHBLSD2 is a rare genetic disorder that is highly variable in its expression and is due to variants in the APOB gene. Treatment of individuals with FHBL is similar to treatment for individuals with abetalipoproteinemia. Celiac disease is a digestive disorder characterized by intolerance to dietary gluten, which is a protein found in wheat, rye, and barley. Consumption of gluten leads to abnormal changes of the mucous membrane, mucosa, of the small intestine, impairing its ability to properly absorb fats and additional nutrients during digestion. Intestinal malabsorption. Friedreich's ataxia, FRDA, is a genetic, progressive, neurodegenerative movement disorder, with a mean age of onset between 10 and 15 years. Affected individuals may also develop slurred speech, dysarthria, characteristic foot deformities, and irregular lateral or sideways curvature of the spine. Scoliosis. Diagnosis. A diagnosis of abetalipoproteinemia is based upon identification of characteristic symptoms, a detailed patient history, a thorough clinical evaluation and a variety of specialized tests including tests to measure lipids, triglyceride and cholesterol, and ApoB-containing lipoproteins in the plasma. Determine the form and structure, morphology, of red blood cells and an eye, ophthalmological exam. Blood tests will detect low levels of both lipids, such as cholesterol and triglycerides, and lipid-soluble vitamins such as A, E, and K. ApoB-containing lipoproteins, such as chylomicrons or very low-density lipoproteins, are not detectable in the plasma. Treatment. Most affected individuals respond to dietary therapy consisting of a diet low in long-chain saturated fatty acids. The reduction of the intake of dietary fats generally relieves gastrointestinal symptoms. The oral administration of high doses of fat-soluble vitamins, e.g., A, E, K, helps to prevent or improve many of the symptoms associated with abetalipoproteinemia. For example, treatment with vitamin E, i.e., tocopherol therapy, and vitamin A supplementation may prevent the neurological and retinal complications associated with abetalipoproteinemia. The prognosis of patients is highly variable. Early detection, treatment and fat-soluble vitamin supplementation can help curtail some of the neurological and ophthalmological deficiencies. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.